It is indeed a happy and good news that most of the Indian medical universities started calling back their undergraduate students after months of suspended physical classes. And for the postgraduates, no need to worry that you lost experiences, you lost chance to do surgeries, the basic surgeries. It's not like that. The experience you got by working in these COVID times is much more than what your seniors or your juniors are going to get. So enjoy the campus life. Also remember to ensure your safety, and remember you are precious and you are part of your parents. Today's class is on lateral wall of nose, and this lateral wall of nose is important for examination theory as well as for clinical purpose. For theory, this lateral wall of nose can be asked as an essay. Lateral wall of nose. A full essay can be asked, and also each parts can be asked as separate short answers, especially the inferior turbinate, then again the middle meatus, then osteometrial complex. In drawing label section also you will get the lateral wall alone or as middle meatus. Okay. And for clinical purpose, without knowing the anatomy of lateral wall, you won't be able to proceed either with the surgeries or to get a correct clinical diagnosis. So I'll deal with the lateral wall under the headings of anatomy, that is the important structures seen on the lateral wall, then the blood supply, the nervous supply and the lymphatic drainage, and towards the end of this class I'll show you the video of a diagnostic nasal endoscopy done in a cadaver, so that you will get a very good three-dimensional concept regarding the structures in the lateral nasal wall. So you can see it here. There are two lateral nasal wall and one nasal septum. Okay, remember that. And it is extending from anterior nares up to the posterior choana, and superiorly it is extending from the cribriform plate up to the palate. It is narrower anteriorly and it is broader towards the base, that is towards the palate, right? And it contains the inferior turbinate, middle turbinate and superior turbinate. What is this? This is a supreme turbinate. Sometime, that is in 60 to 70% of patients, not patients, in 60 to 70% of the normal population, you can see a supreme turbinate. Okay, supreme turbinate superior to the superior turbinate, and of the 60 to 70%, only less than 20% of cases this is well developed. And if the supreme turbinate is well developed, this posterior ethmoid will drain into the area lateral to the supreme turbinate, that we call as a supreme meatus. Actually, this meatae are lateral and inferior to the turbinate. From the lateral wall of nose, these are the turbinate. Turbinates will project like this, and the meatus are seen lateral and inferior to the turbinate. You have to remember that spatial orientation. Meatus, what is the word meaning of meatus? It is a Latin word meaning the passage, and these passages are lateral to the turbinates or lateral to the corresponding bones. Okay. So the lateral wall of nose contain 3 turbinates and 3 meatus, and sometime there will be a supreme turbinate, and if there is a supreme turbinate well developed, then this posterior ethmoid will drain into the supreme meatus. Otherwise, where this posterior ethmoid drain, if there is a no supreme turbinate, then this posterior ethmoid will drain into the superior meatus. Okay, 3 turbinates. This inferior turbinate is a separate bone, and all the others are the superior or the middle, and if there is a supreme, all these are part of ethmoid bone that I have already described along with the osteology of ethmoid bone. Okay, and of the inferior turbinate, you can see it here. It's the largest, and it extends through the entire length of the nasal cavity, and this is actually an irregular. This surface, its medial surface is irregular, and it has got so many vascular channels on the medial surface. There are small channels are here like this, and to these channels the mucoperiosteum is firmly attached. Okay, and this has got an maxillary process. And while discussing the osteology of maxillary bone, I showed you the natural sinus, natural ostium in a disarticulated bone. It was so big, isn't it? It was a big one, and during life, because of the adjacent bones and also the mucosa, it has reduced to a small natural ostium. So this inferior turbinate has got a maxillary process, and this maxillary process articulate with the lower part of the natural ostium. Actually, here comes, this much comes the natural ostium. So maxillary process of the inferior turbinate articulate with the lower part of the natural ostium of maxillary sinus. Okay, and also it has got articulation. What comes here? Here comes the lacrimal bone here. Okay, lacrimal bone, and also it has got articulation with the ethmoid bone. And what comes here? Palatine bone. And also I already told it has got with the maxilla. So inferior turbinate articulate with all the three bones. Lacrimal, anteriorly comes the lacrimal, superiorly the ethmoid, palatine bone posterior inferiorly, and laterally it has got articulation with the maxilla also. Inferior turbinate has got submucosal large cavernous plexus with large sinusoids which are under the control of autonomic nervous system. You might have noticed that during extremes of climate or during your emotional outburst, you get a nasal block. That is because of this inferior turbinate getting hypertrophied, or it become bulging, or it dilates, this cavernous plexus dilates, which are under the autonomic control, and it regulates the nasal resistance. Okay, and in some clinical condition you get an hypertrophy of inferior turbinate, maybe due to disease or bilateral hypertrophy, or due to a compensatory inferior turbinate hypertrophy opposite to the side of deviated nasal septum. If it is causing difficulty or nasal block to the patient, you have to go for a reduction of the inferior turbinate, either using cold instruments or using laser. If you remove the inferior turbinate, you can see the inferior meatus. So I am removing the inferior turbinate. Okay, so lateral to the inferior turbinate comes the inferior meatus. You can see here that it is highest at the point of junction of anterior 1/3 and the middle 1/3. Okay, so this is the junction, and the inferior meatus, it is the largest of the three meatae, and it extends from the entire length of the nasal cavity. And this inferior meatus is the highest point at the junction of anterior 1/3 and the middle 1/3, or the middle 2/3, and the point just anterior to the highest point, you will get the opening of the nasolacrimal duct. And actually there is no true valve in this area, only mucosa covered by at the opening of the nasolacrimal duct. Okay, it comes here. Only important structure which opens into the inferior meatus is the nasolacrimal duct, and you can very well see that area while doing a diagnostic nasal endoscopy by asking the patient to gently rub on his medial punctum. Next I will discuss about the superior meatus, and it comes lateral to the superior turbinate. And what is the structure that is seen in the superior meatus? That is opening of the posterior ethmoid. That's the opening of the posterior ethmoid. So the posterior ethmoid opens into the superior meatus, which is lateral to the superior turbinate, and the sphenoid sinus opens into the sphenoethmoid recess, which lies medial to the superior turbinate. Don't get confused. So posterior ethmoids open into the superior meatus, which is lateral to the superior turbinate, and sphenoid sinus open into the sphenoethmoid recess, which lies medial to the superior turbinate. Okay. So the only structure which is opening into the superior meatus is the opening of the posterior ethmoid. Right? Now the most important part is the middle turbinate and the middle meatus. Regarding the middle turbinate, it was discussed in detail with the help of an origami for spatial orientation in Anatomy and Osteology of Ethmoid Bone Part 2. I am not going again to the details. Please see that video before you start seeing this lateral wall of nose. So I am removing the middle turbinate. Okay. After removal of the middle turbinate, in a disarticulated skull, in a cadaver skull, there is a natural ostium which is very wide that you can, I have shown you in the along with the class on maxillary sinus, maxillary osteology of maxilla. And in life, this natural ostium is reduced to a very small size by bone and also by the connective tissue mucosa. So in life, this natural ostium is reduced to a smaller area by in the lower part it is by the inferior turbinate, and anteriorly it is by the lacrimal bone, and superiorly what contributes? It is part of ethmoid by the ethmoid bulla and the unsignificant process. So superiorly there comes the ethmoid bulla and the unsignificant process, and posteriorly what is here? It is the perpendicular plate of palatine bone. Okay. Right? So the big natural ostium of the big maxillary hiatus of the disarticulated bone is reduced to a small natural ostium in life. And in life it is closed superiorly, anterosuperiorly by the lacrimal bone, this part. Inferiorly you have the inferior turbinate. Posteriorly you have the perpendicular plate of palatine bone coming, and superiorly you have the ethmoid bulla and also the part of unsignificant process. And even after that there is a space, this blue color, there is no bones here. Okay, so that forms the membranous part, and this membranous part is filled by mucous membrane of the lateral wall of nose, and then by the mucous membrane of the maxillary sinus, and also by some connective tissue. Okay, so this lateral wall or the middle meatus has got a bony area, and there is also a membranous area. Okay, right? And below that there is also the natural ostium, and this membranous portion or this membranous part is divided in life by the unsignificant process. There comes the continuation of the unsignificant process like this. Okay, so what happens? There is a membranous area, and this unsignificant process, I was repeatedly telling that unsignificant process has got a lower attachment which is always into the inferior turbinate. Superiorly it can go either to the lamina vaparaceae of the orbit, or it can go to the middle turbinate, or it can go to the skull base. So in any case this unsignificant process comes like this. So what happened? This divides this membranous portion into two halves, which is anterior to this and also posterior to this. Hope you got it. The natural ostium or the wide natural ostium of the maxillary bone is reduced in life to a small area or the small ostium by these four bones and also by the membranous area. And in between the membranous area comes the unsignificant process, which divides this membranous portion into an anterior part and a posterior part. And that is called the frontanellas. Okay, that is a frontanella. Frontanella. So how many frontanellas are there? There is an anterior frontanella, which is anterior to the unsignificant process, and also there is a posterior frontanella. Anterior frontanella which is anterior to the uncinate process, and there is a posterior frontanella which is posterior to the uncinate process. And in these frontanellas comes your accessory ostia. Okay, accessory ostia comes here. Accessory ostium. This accessory ostium has got a present in 5 to 6% of the normal population and 25% of patients with a chronic sinusitis. Okay, so now you know the placement of accessory ostium and also the frontanelles. Okay, so they are the parts of membranous area in the middle meatus, which is anterior and posterior to the uncinate process. Okay, and you know that when there is an infection in the middle ear, the infection comes and then it bursts the tympanic membrane. That is how we get an perforation of the tympanic membrane. Like that, here also, when there is an infection of this maxillary sinus in a chronic sinusitis, this will come and cause bursting. The pus, anyway the pus inside under tension has to go out. So it can't burst open the bone. It is easy to burst open the membranous portion. So it comes and make openings in the membranous portion. So that is how this accessory ostia forms. That is what the theories say. Okay, so it is present in accessory ostia are present in 5 to 6% of the normal population and 25% of the population having chronic sinusitis. And which frontanella is larger than this, anterior one or the posterior one? Definitely this is a posterior one, or the posterior frontanella is larger than the anterior frontanella. So you get accessory ostia most commonly in the posterior compartment, posterior frontanella. That is why this accessory ostium is more commonly seen posterior to the natural ostium. Okay, I have cleaned that area for you, so it will be more easy for you to understand. I am emphasizing this because to know the basic anatomy of the middle meatus is very important. Okay, then only you can go and do an endoscopic sinus surgery. So we talked about the frontanella, anterior and posterior frontanella, and about the accessory ostium. Then the important structure that comes here is an uncinate process. I have already told about this in my class on both frontal sinus and also on anatomy of ethmoid again. Once again I will tell you the uncinate process. Uncinate process is a crescent of bone. It is a crescent-like structure or a sickle-shaped structure like this. It has got an inferior attachment, a superior attachment, an anterior attachment and a posterior attachment. Okay, think a structure like this. So it has got an inferior attachment, a superior attachment, it has got an anterior attachment and a posterior attachment. Okay, like this, a crescent of bone like this, exactly like this. So the inferior attachment is always into the inferior turbinate. Okay, this inferior attachment is always here. I will draw with the red ink. Always this inferior attachment is into the inferior turbinate, right here. So from here, this is the interrupted line is the uncinate process. So the inferior turbinate makes the inferior attachment. And what about the anterior attachment? Anteriorly, it is attached to the lacrimal bone. Here comes the lacrimal bone anteriorly. So it is attached to the lacrimal bone anteriorly, and posteriorly, actually the posteriorly it has got a free border. Okay, this posterior border is free. Posterior border is free posterior border. That I will show you while doing the diagnostic nasal endoscopy. And the superior attachment can vary. Just 3 variations can happen in the superior attachment. Either it can go and attach to the lamina papyracea, which is when the orbit, if the orbit comes here, this forms the lamina So it can go and attach to the lamina, that is one attachment. Then or it can go and attach to the middle turbinate, or it will go directly superiorly and go and attach to the skull base. So the attachment of the uncinate can be superior attachment either to the lamina papyracea laterally, or medially it can go and attach to the middle turbinate, or superiorly it will go and attach to the skull base. And the clinical significance of each I have discussed along with the previous class on ethmoid sinus and also along with the frontal sinus, right? So that is regarding the uncinate process. So this interrupted line becomes the uncinate process. Then the important structure is the bula, ethmoid bula. Bula, it was already discussed along with the osteology of ethmoid bone. Again, it is the most constant and the largest anterior ethmoidal cell. Just get a three-dimensional picture. This is from anterior to posterior, isn't it? So what happens? This bulla will project from posteriorly. This is my posterior. From posteriorly, this bulla will project into the middle meatus because it is the anterior ethmoidal cell. So behind that is the basal lamella. From the anterior to the basal lamella, this will project, and below is the inferior turbinate, isn't it? So from the inferior turbinate, this uncinate process will come anteriorly. Okay, so anterior to the ethmoid bulla, what comes the posterior free border of the uncinate process. You got it? Actually, I'll get the lateral view. See, from posteriorly the bulla is projecting, and anterior to that comes the uncinate process. This is the posterior free border of uncinate. This is the anterior attachment of the uncinate to the lacrimal bone. Anterior relation of the ethmoid bulla. Anterior relation of the ethmoid bulla is the posterior free border of uncinate process. That is shown here. This interrupted margin is the uncinate process. Okay. And this is the ethmoid bulla. So another structure is the ethmoid bulla. Got it? Now, there is a space between this uncinate process and the ethmoid bulla. That is, between the free border of the uncinate process and the anterior face of ethmoid bulla, there is a two-dimensional space. And that two-dimensional space, this red marked area, it is called the hiatus semilunaris. Okay. Hiatus means opening, semilunaris means like a crescent shaped. Right? Because this uncinate process, I told you, it is crescent shaped, and here comes your ethmoid bulla. So in between this, there is a potential space. There is a two-dimensional space. It has only length and width. It has no depth. Okay. So this two-dimensional space is called hiatus semilunaris. This maxillary sinus is not directly opening into the middle meatus. It is opening into the ethmoid infundibulum, which is an area between the uncinate process medially and the lamina papyracea laterally. So from the ethmoid infundibulum, this will go or come to the middle meatus through this hiatus semilunaris. Got it? Your ostium, natural ostium of the maxillary sinus. Remember, think that this is a natural ostium, and this natural ostium will not directly open. From here it will not directly come to the middle meatus. First it will go to the ethmoid infundibulum, which is an area bounded by the uncinate process and your lamina papyracea, and from the uncinate process it will come through this hiatus semilunaris into the middle meatus. Okay, so this hiatus semilunaris is a two-dimensional space between the posterior free border of the uncinate process and the anterior face of ethmoid bulla. And also this frontal sinus drains into the most anterior part of the middle meatus, and the anterior ethmoidal cells drains into the middle meatus through the bulla, ethmoid bulla, and also your maxillary sinus opens. So the frontal, maxillary and anterior ethmoidal cells open into the middle meatus. So another terminology comes there is a osteomeatal unit or osteomeatal complex. Osteomeatal unit or osteomeatal complex. It is very simple. It is an area in the middle meatus. This area is called the osteomeatal unit, and it is a terminology coined by Newman, and this is the key area in a functional endoscopic sinus surgery, and any anatomical variations of any one of these structures, anatomical variation of any one of these structures will cause stenosis or an obstruction of the osteomeatal unit, and that is supposed to be the basic pathology contributing to the development of a sinusitis. So this OMC or the osteomeatal unit or the osteomeatal complex is a key area in a functional endoscopic sinus surgery, and this is an area in the middle meatus to which the frontal sinus, the maxillary and anterior ethmoidal area sinuses drain. This one. Okay. To summarize about the lateral wall of nose, we have three turbinate, the superior, middle as well as the inferior turbinate, and in the inferior turbinate being the largest bone of the three, and it is also an independent bone, and the inferior meatus, there is opening of the nasolacrimal duct at the junction just anterior to the junction of anterior 1/3 and the posterior middle 2/3, and in the superior meatus opens the posterior ethmoidal sinus, and the sphenoid sinus opens into sphenoethmoid recess, and in the middle meatus it told about the fontanella, the uncinate process, and also the bula, that is bula posteriorly and the free border of uncinate process anteriorly, and in between these two comes the hiatus semilunaris, and also we talked about the osteomeatal complex. So we can come back after seeing an endoscopy done in a cadaver specimen. This is the lateral wall of nose with the inferior turbinate, the middle turbinate and the superior turbinate. That is a sphenoethmoid recess medial to the superior turbinate. And this is the middle meatus, which is the most important meatus. There you can see the uncinate process, and posterior to the free border of uncinate process comes the bulla, that is ethmoid bulla, and between the anterior face of ethmoid bulla and the posterior free border of uncinate process comes the two-dimensional hiatus semilunaris. Actually, the maxillary sinus ostium opens into the ethmoid infundibulum with the uncinate process as a medial border, and the lower attachment of the uncinate process is always into the inferior turbinate, and between the uncinate process and laterally the lamina papyracea, the ethmoid infundibulum comes, and on removing the uncinate process you can reach the infundibulum, otherwise called the infundibulotomy or uncinectomy. This is using a backbiting forceps. Remove the uncinate process, and now we are in the maxillary sinus ostium, and in this case there is an accessory ostium also, and if there is an accessory ostium it has to be combined with a natural ostium. So this is how the natural ostium combining with the accessory ostium to make it into a single cavity or a single opening. And on removing the upper part of the uncinate process, you should be very careful while removing the upper part, as there are three variations in the upper attachment, as I have already told you. On removing the upper part of unsignificant process, here a debrider is being used, and you can see the agarnaceae cell, which is the anterior most anterior ethmoidal cell. This is the agarnaceae. If it is highly pneumatized, it can cause blocking into the frontonasal duct or the frontal recess area. And after removing the agarnaceae, here comes the frontal recess, and this is the opening of the frontal sinus, which is into the antero-superior part of the middle meatus. And if you open the ethmoid bulla, you reach the anterior ethmoidal cell. This is the anterior neurovascular bundle. Now you can see the middle turbinate, the middle meatus. You are going into the anterior ethmoidal cell, and that is a basal lamella. The part of middle turbinate is already described in the class. So on puncturing the basal lamella on the medial and the inferior part, you will reach the posterior ethmoidal cell. Once again, the lateral wall of nose contains the inferior turbinate, middle turbinate, and the superior turbinate with the corresponding meatus. Histology, and in the histology, this is mainly lined by ciliated columnar epithelium of the respiratory type, except for a small superior part, this much of area, superiorly lined by the olfactory epithelium. And what about the blood supply? The blood supply of the lateral wall, like that of the nasal septum, is both from internal carotid artery and also from the external carotid artery. Okay, this is the sphenopalatine foramen. So this sphenopalatine foramen lies inferior to the horizontal portion of the middle turbinate, and from there, this is the sphenopalatine artery, which is a branch of maxillary artery, which is in turn a branch of external carotid artery. Okay. So the main supply is by the sphenopalatine artery. It supplies a branch to superior turbinate, the middle turbinate, and also it supplies a branch to the inferior turbinate. And the importance of branch to inferior turbinate is that it actually goes deep to the inferior turbinate, and then it comes anteriorly. So there is a part, this much part, there is this central portion of the inferior turbinate is relatively avascular. Okay. So, and also there is a area of this much area is supplied by the greater palatine. Okay, palate. So greater palatine artery. Here this much of area is supplied by the greater palatine artery, and also anteriorly there is an area which is supplied by the facial artery. Okay. And the internal carotid artery supply is through posterior ethmoid and also by the anterior ethmoid, like that of the nasal septum. So there is a considerable overlap between the internal carotid system and that of the external carotid system. So internal carotid by branches of anterior ethmoidal and posterior ethmoidal. External carotid mainly by the sphenopalatine artery, greater palatine, and anteriorly or anteroinferiorly it is mainly by the facial artery. And regarding the veins, it goes from facial and ophthalmic vein, it drains into the sphenopalatine veins, and from superior part it goes through the ethmoid vein to the veins of dura and also anastomose with the superior sagittal sinus through foramen cecum. I said anterior to the cribriform plate there is foramen cecum. So through the foramen cecum, this anterior ethmoidal veins communicate with that of the superior sagittal sinus. Okay. And also, as I told earlier, there is a cavernous plexus in the submucosal plane especially in the inferior turbinate, and also there is greater anastomosis happening there, and they are under the autonomic control also. In the nerve supply, a part, superior part here, that is superior part of the lateral wall along with the superior turbinate area is supplied by the olfactory. Okay, olfactory nerve, and anteriorly it is supplied by anterior ethmoidal nerve, and the major supply here, the major part is supplied by the pterygopalatine ganglion. Okay, pterygopalatine ganglion, and also small branches from the maxillary nerve. And here you can see an overlap area between this maxillary and anterior ethmoid. And anteroinferiorly, the lateral wall is supplied by the intraorbital. Okay, ophthalmic division of trigeminal. And here, which is this part supplied? This part is by the anterior superior alveolar nerve. That is why if you do a very large inferior meatal androstomy, sometimes there will be, patient may complain of pain in the upper teeth, or there will be altered sensation, or dental pain, the patient will complain. That is because of this anterior superior alveolar nerve supply by on the lower part towards the floor of the lateral wall. So this is regarding the nerve supply. And lymphatics. What about the lymphatics? The lymphatic supply anteriorly it goes to the submandibular, posteriorly it goes to the retropharyngeal and also to the anterior upper deep cervical and also to lateral pharyngeal nodes. Okay, so regarding the lateral wall of nose, we discussed about the 3 turbinates and the 3 meatas which is lying lateral to that, content of the inferior meatus which is the nasolacrimal duct, and the middle meatus mainly the osteometal complex and also the drainage of frontal, anterior ethmoid and maxillary sinuses, the osteometal complex, the spatial orientation of the uncinate process, bulla, hiatus semilunaris and also the ethmoid infundibulum, and to the superior meatus opens posterior ethmoidal sinus, and medial to the superior turbinate lies the sphenoethmoid recess to which the sphenoid sinus opens. And also we talked about the histology, the blood supply that is mainly from the sphenopalatine artery, and also the nerve supply and also the lymphatic drainage. Okay.